Hello and welcome everybody to the Elets Innovation Talks. Today we have a very eminent panelist here with us. We have Dr. Devavrat Arya, who is the Senior Director of Oncology at Max Institute of Cancer Care, New Delhi. And his focus areas are around cancer care, musculoskeletal oncology, medical oncology, thoracic oncology, head and neck oncology, breast cancer, and molecular oncology and cancer genetics. So, sir, we are so happy to have you on our show. Thank you so much for joining.
Good evening, and thank you for having me here. Thank you very much.
Great. And I would be hosting the session today. I am Dr. Asavri Saval from Elets Technomedia team. So, my first question to you, sir, is can you please provide a brief overview of your journey and your experience in this field of oncology? Why did you choose oncology? What was the motivation behind it? Or were there any, key factors in your life or, prominent moment in your life that turned you towards oncology?
Yeah, so my first encounter with a cancer patient happened during my MBBS days, and this is way back in 1999. LNJP Hospital, Maulana Azad Medical College. In fact, that's when I did the first chemotherapy for a young lady who had a breast cancer. And think of it, one of the premier government-run institutes in the city, and the chemotherapy was being done by an intern in a surgical department and not by a medical oncologist. Subsequent encounters were during my MD, and I think cancer came across as a very difficult disease. In most cases, the patients succumb to the disease, and it clearly was a huge challenge. And you'd be surprised to know that a lot of the medical community did not look up to oncology as a promising field. But then things started changing I was preparing for my super specialty examination. I actually came across some research which promised change in the way we handle cancer. And I think some of those promises, some of those researches actually egged me on towards picking up this field. I joined Gujarat Cancer Research Institute in Ahmedabad in 2008, and that's when it hit me. I saw the huge number of patients that suffer from this disease, the complexity of the disease. Cancer is not one disease, actually 200, 300 odd different kinds of diseases. The need and how cancer is not just a disease of the person who's suffering, but also the entire family, how it impacts livelihoods, how it impacts the social roles that people play, how economic financial impacts are there, and the impacts are carried over to multiple generations. And and then what also hit was the amount of research that is happening, not just in the Western world but also in India. I think all of that still motivates me to continue working hard in the field of oncology, but we have a fair distance to
Definitely, sir. You were able to, in a very short time, touch upon various different aspects that we would be discussing today. The psychosocial aspects around cancer care, as you mentioned, also the support for the families that is required. We would be discussing more in deeper. So, as of now, my next question to you would be: how has these emerging technologies that you must be observing, such as AI, ML, has impacted the field of oncology or has impacted your practice in specific, and what specific advancements do you find most promising, if any, for improving cancer care?
yeah, so I think both the questions are very similar, so I'll probably answer both of them together. I think what we've seen since the emergence of the pandemic is we've had an acceleration on the development of technology, and that was driven by the fact that most countries were reeling with lockdowns, difficulty in accessing healthcare, and oncology is a field where it's not just one encounter; it's repeated encounters between the patient and the healthcare providers, and it sort of accelerated that. And I think one of the key things that happened was telemedicine, which was not only approved, legalized, but well recognized and well utilized as well. But when you look at the need of technology in oncology, uh, oncology is moving from one size fits all approach to a more personalized approach, where what we are trying to do is, tailor a treatment based on the patient, the characteristic of the disease, the age. So individual characteristics rather than answering. different question with the same answer. I can't have the same chemotherapy regimen for any and every lung cancer patient who presents to me. So we are looking at more personalized treatment, and a part of that personalized treatment is driven by genomics. Genomic means a lot of data, and as a human, as an individual, I may not be able to analyze data. And I think AI is already, and increasingly in the future, going to come into the analysis aspect of that data. We already are looking into how AI can help with diagnostics. So we have algorithms which actually, point out on a CT scan if there is a lung nodule, if it could be suspicious. So radiology, CT scans, MRs. I think increasingly pathology also. You'd have AI reading the slide and actually not diagnosing, but at least throwing up a red flag, calling to attention the findings over there, which then a pathologist, a person could do. Um, I think increasingly we are going to have incorporation of AI into treatment planning. So you'll have algorithms, set algorithms, expected algorithms, and if a clinician is going off track, perhaps the AI would bring the clinician back on track. Red flag if a test has not been ordered, red flag if a medication is being utilized.
Yeah.
So treatment planning, uh, and perhaps clinical trial optimization as well. We discuss how we have different clinical trials, and as a primary investigator in multiple clinical trials, we always struggle to reach out to different clinicians and say, do you think you have patients who are going to fit into a clinical trial? And we have vice versa situation as well. You have a patient who would want to look out for a clinical trial, but I as a treating clinician may not know the inclusion exclusion criteria of different trials, and perhaps AI could actually help in optimization of clinical trial recruitment, facilitating research. I think potentially in the future, there's role for drug discovery, perhaps using AI to understand which molecules could be promising, greater role in clinical decision supporting, perhaps remote patient monitoring as well. And there's this new term that I learned, natural language processing. I think it's very relevant. How do you translate a clinician's note, and get out data from those notes and organize it a little better, so that they can be analyzed later on. So I think there's a huge promise that AI and machine learning brings in trying to organize data, help in appropriate diagnostics, help in delivering appropriate care to the patient, and then facilitating research as well.
Yes.
Yeah.
So now that we have you, so my next question is, we have seen it is flashed into public health studies that majority of the cases that are detected of cancer in India gets detected at the very last stages, stage 4. And there are very less cases that gets detected at the earlier stages. So while early detection is very much important and very much advocated, how does your treatment protocol vary from somebody detected at the last stages and somebody detected at the early stages? And also, how do you manage the families of such patients who are detected at the very last stages?
So I think you are absolutely okay. You are absolutely correct when you say that. Unfortunately, in India, most of the cancers are detected in the more advanced stages. As a part of my initial clinical research during my training, I was looking at the epidemiology of cancer in India, and we're not just talking about patients who present to a private hospital. I mean, that is a small chunk of the cancer patients. The majority still go to a government hospital or a government facility. And when you look at that data in India, about 50 to 60% patients actually present in stage 3 and stage 4. And that means only about 40% are stage 1 and 2, which is in sharp distinction to the data that comes out from the Western countries. 85 to 90% of cancers in the US are stage 1 and 2. And only about 10 to 15% are stage 3 and 4. So it actually highlights a lot of things. Lack of awareness amongst patients. People ignore their symptoms. We won't go to a doctor if we have a symptom which is suspicious or doesn't resolve over a period of time. uh, There's also to some extent lack of sensitivity amongst doctors, or awareness amongst doctors. To be able to do the right test at the right time and refer to the right doctor is also crucial. And therefore, any patient who has a cough and some shadow on the x-ray doesn't mean that that patient has a tuberculosis, which is a default diagnosis for a majority of doctors even now, because these patients should still have a CT scan, should perhaps have a biopsy or a bronchoscopy, which can, in that case, actually rule in tuberculosis, or perhaps diagnose a lung cancer early. So lack of awareness, and then absolute absence of government sponsored screening. And I understand, I think the focus in India in terms of oncology is still trying to treat every patient who's diagnosed rather than screened. So I think we are not quite there as yet, which means that a majority of patients present in advanced cure are going to be less. So, if we have a stage 1 disease, you'd probably look at 80 to 90% cure rates. If you have a stage 2 disease, you're probably looking at 60 to 80%. If you have stage 3 disease, a cure rate of only about 30 to 40%. Of stage 4 disease, cure is unlikely, although there are 10 to 20% patients who make it beyond 5 years. The other issue is, higher the stage, greater the amount of treatment needed. A stage 1 breast cancer may get away with just surgery, perhaps a little bit of hormone therapy, may not need chemotherapy, may not need radiation therapy. Whereas I'm sure a stage 3 breast cancer will need all three: surgery, chemotherapy, radiation therapy. So, when you have more treatment going in, you have more side effects. And when you have more treatment going in, you have more expenditure. And if the expenditure is being borne by an individual, or if the expenditure is being borne by the government, expenditure is expenditure, and it takes up time. Unfortunately, stage 4 is a challenge in its own. We still encounter quite a number of patients. I still encounter quite a number of patients in my clinic who unfortunately are diagnosed with stage 4 disease. It's an emotional challenge for the patient. It's an emotional challenge for the family. It's also an emotional challenge for me as a doctor, because how do you tell a patient that it's a complicated diagnosis and challenging disease. And therefore, the handling involves talking about science. Obviously, one has to inform the family and the attendant about what we are dealing with, creating treatment options, you know, trying to give options to a patient. And there may not necessarily be just one option. There are always multiple options with different effectiveness, different side effect profiles, and a patient has a right to choose. Also taking care of other aspects like the psychology of the family, and therefore involving the paraclinical staff, like a clinical psychologist, a dietitian, involving patients in support group programs where they get to interact with other patients who either are suffering or have suffered in the past with cancer. All of that helps.
Thank you so much, sir. And very aptly, you have shared all the specific details that are required. So I'm sure the audience that is listening, the future oncologists that are taking inspiration, are noting everything down. So another thing that we would want to know is, are there any specific challenges that you still face in delivering optimum cancer care? And how do you foresee technology addressing these challenges in the future?
So, multiple issues here. I think we've discussed one part of it, that a lot of patients come with more advanced stages, which means that a lot of these patients will need multi-modality treatment, different modalities: surgery, medical, chemotherapy, or radiation therapy, or a combination of both. And a significant number of these patients will have advanced cancers. And at least in my practice, there would always be some patients who have affordability issues. And I'm sure in a government setup, the question of affordability is a bigger challenge, because not every facility may be available in a government hospital. Now, the other issues that we face is that India is a huge country, and logistics becomes a concern. So, a patient may be able to travel to me from a city which is as far away as Lucknow is, or say Cuttack is. but how do you engage the patient in the period between he or she has come to me for treatment? If I'm doing chemotherapy once every 21 days, how do I engage with this patient in those 21 days between the chemotherapies? How does the patient connect to me if there's an issue? And I think some of those issues tech is beginning to solve. As I said right at the beginning, I think COVID has to some extent accelerated it. And I think one of the key advances of COVID has been telemedicine, the legalization of telemedicine. And at my hospital at Max, we've actually incorporated teleopds, teleconsultations. So you have an application, you actually get to look at the patient gets to look at you. So it's a very face to face kind of a thing. Although even though it's virtually, the patient can upload his or her results. You can look at those results, you actually prescribe, and the prescription is an electronically generated prescription, which as per the latest laws is valid. So a patient doesn't need to travel for everything. The patient actually can consult from a distance. And I think that's one of the key factors that has been facilitated by the emergence of technology. We have patient portals now available. So a patient actually has an access to all his or her health records and investigations on that portal. Patient does not need to have printed copies, does not need to go through all her folders or old files to see where things are. We have virtual support groups. So simple things like WhatsApp and Telegram actually allow patients to have a forum of discussion, and they don't need to be in the same place. They don't need to sit together. They can actually do it 24 hours of the day uh, with these virtual support groups. On a medical aspect, I think what technology is actually letting us do is, we have collaboration amongst different departments, collaboration amongst different teams of oncology. I need to collaborate with my radiation oncologist, surgical oncologist. We have things like multidisciplinary tumor boards where all three of us, or perhaps even the pathologists and the radiologists, need to come together. And we have now virtual platforms where you could actually have a tumor board sitting in different places, different rooms in the same building, different buildings in the same complex, different complexes also. And in fact, you could actually consult the patient could actually consult an international expert for that matter. You could have an international tumor board. And then, as I said, genomics, precision oncology. I think all of that is changing. Although I would want it more and more and more applicable to as many patients as possible. I think we are seeing the initial few advances in this field, and how it's helping us personalize the approach of patient and improve outcomes compared to the more traditional treatments like chemotherapy.
Thank you so much, sir. That was very nice, and you touched upon very many different aspects that are very much required. So, coming down to the last two questions for our session today, what would be your for the young professionals that are aspiring to specialize in oncology, what would be your advice that you would give them, considering the evolving landscape of oncology and also considering how not easy oncology is to pursue?
Yeah, so I always joke with my residents. We have a DNB oncology teaching program at my hospital. I am a DNB teacher. So I always joke with my doctors that, 5 years down the line, you'll have to forget what you've learned here and you'll have to learn something new. That's the pace at which oncology is changing, and that's how the treatment protocols are changing. And I think it's for the good. We need to understand this complex disease a little bit more, in fact a lot more, so that we are able to deliver better quality of care and we are able to improve outcomes. A few years ago, patient living with stage 4 lung cancer beyond 5 years was an exception. Nowadays, we expect 20 to 30% of our patients, one in three, with a stage 4 lung cancer to actually make it beyond 5 years, and that's a huge leap that has happened. I would want all three of those patients, all 100% to live, but I think 20 to 30% looks a lot better than 5% that was there a decade ago. So my advice to my younger colleagues is stay informed. Oncology is ever changing. Keep abreast of the latest advances. Keep on learning, and it's a lifelong learning. And this is the most applicable to my field, oncology. You are lifelong learners. I think with the changing environment, I think we have to embrace technology. AI is going to be a bigger part of the whole piece. Machine learning is going to help us deliver care better. Collaborate. You can't just treat a patient alone. Those days are gone. Oncology, you need to talk to your surgeon, you need to talk to your pathologist, your radiologist, your radiation oncologist. I think it's very important that you collaborate, you discuss, you sit down, plan out treatment for each individual case, sitting together. And it's not only better treatment for them, for the patient, it's also a lot of learning for me as a doctor when I collaborate. Seeking mentorship. you know Not everything comes from books. There's a lot of importance to experience. I think it's important that you seek out to somebody senior who's been there in the field for a decade, of couple of decades. Try and understand what are the initial few steps, how to build up a career, how to excel in what you do. Communication skills is something which is very important. And I believe it's not applicable just to oncology, it's applicable to all doctors. And you have a background of public health, and I think you'd understand how communication skills are important and how communication skills are actually ignored in the profession. And I would say particularly in India until the time I was studying. uh, and finally, you have to be patient centric. I am treating a patient. That patient is a human. That patient plays a huge role in his or her family. There are people dependent on him or her. There has to be a lot of empathy, lot of understanding, lot of compassion. Uh, the first loyalty and the only loyalty is to the patient. You have to look at not just the physical health of the patient, you have to look at the emotional health of the patient, psychological health of the patient, sometimes financial aspects as well. Lastly, be adaptable. uh, Try and do research if possible. It's very important that you do research. And network, go to conferences, pick up what's happening in the field of oncology, where the newest research is headed towards, and that can also help you grow in your career.
Thank you so much, sir. And our very last question for the session is your key takeaway message to the audience, the industry audience that is watching. Maybe your expectations from the digital oncology providers or from the government side.
So, oncology is evolving. I think I can't say that we are sitting on a cancer epidemic, but our numbers are going to increase tremendously in the future. And our numbers have increased tremendously in the past couple of decades, and they're going to really go up. The field is changing. I think what I would want is technology to enable more patient engagement. Uh, I am really looking forward to remote patient monitoring, how it can actually help pick up symptoms earlier, prevent complications, optimize use of healthcare and resources. I'm really looking forward to it. I'm looking forward to some of the advances that we expect in the field of genomics, precision oncology, immunotherapy in its different forms, and the integration of all of that. From a primary clinician, I would want more, a higher degree of suspicion. Let's investigate all our suspected patients with the right tests at the right time. Let's refer these patients at the right time, and it's applicable to all of us. If I have a patient who comes to me with a chest pain, I have to order the right test and send him or her to a cardiologist at the right time. So it's applicable to everyone. I want my patients, or normal people, to seek healthy lifestyle, indulge in healthy lifestyle. you know Try and get the cancer prevention vaccines, like the cervical cancer vaccine. Undergo the screening test, and in the near future you could actually have a blood based screening test that actually looks at 50 different cancers, and that's also an advancement in the field. And to the government, I think it's very important in a country as big as India is, with wide variation in the resources that are available to the patients, that healthcare is available, accessible, equitable. I think just because a patient may be from a poorer background doesn't mean that he or she should not have access to the top of the line care. So I think all of us have to work together here, all of us, and ensure that we push back against this disease. We may not be able to wipe it out totally, but we push back against this disease. we prevent cancers, we pick up cancers early, and we cure as many as possible with the least long term and short term side effects.
Thank you so much, sir. With that, we come down to the very end of our very insightful and very informative discussion for today. Thank you so much, Dr. Devavrat Arya, for taking out time from your busy schedule and imparting us with wealth of knowledge and information. Thank you. With that, we close the session off. Stay happy, stay healthy. Thank you.
Thank you very much.